Good day. My name is Marius Miguel Vismonte and I am a student nurse from San Beda University. And today, I will be demonstrating the Sitz bath procedure or the Sitz bath technique. But before anything else, we need to develop first the prerequisite skills that we need for this demonstration. And with that, we need to understand that Sitz bath is a type of therapeutic warm, cool, or cold bath that can be used in the treatment of anorectal or gynecologic conditions that includes the following. Number 1, hemorrhoids. Number 2, recent renal surgery. Number 3, tearing of the perineal tissue during childbirth, episiotomy, and also the perineal, anorectal, or vaginal infections. And then afterwards, we also need to develop the knowledge of the use of the Sitz bath to heal injured tissue, relieve localized pain, and prevent or treat any kind of infection. And then it is also important to raise an awareness that it is the clinician's responsibility to maintain patient safety by providing water of the right temperature and physical assistance to the patient when lowering to and rising from the Sitz bath. And then also we need to understand that there are certain facility protocols regarding the Sitz bath. And then we need to review the facility or unit specific protocol for performing the Sitz bath if one is available. And then we also need to review the treating clinician's order to performing Sitz bath, noting that the bath should be warm or chilled, whether any medications should be added to the water. And then afterwards, we need to review the instructions for all the equipments to be used and verifies the equipment if it is all in good working order. And then afterwards, we also need to verify the completion of the facility informed consent documents, which serves as a very important factor before starting any type of procedure in the hospital setting. And then afterwards, we also need to review the patient's history, medical record, to assess for the following. Number 1, increased risk for scalding injury if using a warm Sitz bath due to sensory impairment or history of a medical condition. Example is diabetes mellitus associated with impaired sensation. And also we need to check for any type of allergy, which can either be an allergy from latex or any type of medication. And after that, we need to use any type of alternative materials that can avoid such allergies if it is appropriate. And then afterwards, we need to gather the supplies that are necessary for the procedure, including the following. Number 1 is the non-sterile glove, which we have here inside our bag. Additional personal protective equipment, or also known as the PPE. Examples are gown, mask, protective eyewear, and etc. These PPEs or personal protective equipment can be needed if exposure to body fluids is anticipated throughout the procedure process. And then afterwards, we also need to prepare a portable Sitz bath kit, and including a basin, a bag and tubing if not using a bathtub. If we're going to use a bathtub, we will need a rubber ring and a towel for the floor of the tub, and then any prescribed medication, which we have here. In this case, we will be using povidone iodine or iodine, which is known as the betadine. And then we also need a bath or utility thermometer. We also need towels, patient gown, bath mat, bath blanket, and facility-approved disinfectant. And also we need to include a facility-approved pain assessment tool for the assessment of our patient. And then after that, we need to perform hand hygiene. In performing the hand hygiene, we can either use soap and water if there are any visible stains in our hands. But in this case, we will be using an isopropyl alcohol because there are no visible stains in our hand. In performing the hand hygiene, we need to make sure to follow different steps and appropriate steps. And then after that, we need to apply non-sterile gloves, which we have here. And then we also need to apply our personal protective equipment after this one. In this demonstration, I will be using an apron instead of full personal protective equipment. So again, this is our apron that will serve as our personal protective equipment. So we need to observe the proper technique of only touching the edges. And then after that, we need to identify the patient according to the facility protocol. So we can either use different patient identifiers, which can be the name, the patient birthday. So, good day ma'am. I'm going to ask you some questions. May I know what is your name? Okay, ma'am Piglet. I'm going to ask for your birthday. Okay, ma'am. And then after that, we also need to check the patient's ID band for confirmation. And then after asking for the patient's information, we need to establish privacy by closing the door or closing the door to the patient. And then we also need to draw the curtains surrounding the patient's bed. And then after that, we need to introduce ourselves to the patient and the family members if they are present within the room. And then we also need to explain the clinical role in performing the Sitz bath and access the coping ability of the patient and the family, and for knowledge deficits and the anxiety regarding the procedure, which is the Sitz bath. So, good day everyone, if there are the family members. And of course, good day to you, Ma'am Piglet. Today, I will be performing the Sitz bath, which is an important therapeutic procedure that will help you in your healing process. So the process involves sitting in the Sitz bath itself, and it can either be warm water or a chilled water. So this process will help you and relax you so that your wounds will heal faster, and so that it will help your perineal area to heal any type of wound. And with that, you're going to experience soothing factors or relaxing factors. And then after that, we need to determine if the patient, family, requires special consideration regarding the communication. Example, due to the factors like illiteracy, language barriers, or deafness. And then with that, we need to make arrangements to meet these needs if they are present. And then we also need to follow the facility protocols for using a professional certified medical interpreter, either in person or via phone, when a language barrier exists. And then afterwards, we need to explain the details of performing the Sitz bath, including its purpose that I have mentioned earlier. And then we need to answer and entertain any question and provide emotional support as needed. And also we need to assess the patient's general health status, including his or her pain level, using a facility-approved pain assessment tool. So in assessing the patient's general health status, we can either use we can either check for her vital signs, including her pain level or pain threshold. And then we need to encourage our patient to void before starting with the procedure. And then afterwards, we need to prepare the Sitz bathtub and add the medication to the water if it is prescribed. So in this case, we will be using povidone iodine, which is also known as betadine, for our procedure. So this is our medication. So let's say that we're going to apply it within the Sitz tub. So we're going to apply the betadine. And then also in some procedures, they require or suggest adding up an Epsom salt for at least 3 tablespoons. And then after doing that, if we are using a bathtub, we need to place a rubber ring covered with a towel on the floor of the bathtub for patient comfort. And then afterwards, the next thing that we need to do is to fill up the portable Sitz bath with enough water to cover the patient's buttocks and the genital area. So we're going to pour on the water to the Sitz tub. So we're going to put on the warm water. So in this demonstration, we will be using the warm water for the healing process of our patient's perineal area. So we're going to pour it on. We need to remember that this tub has already its medication according to the doctor's order. In pouring the water, we need to make sure that it will cover the perineal or the perineal area. And then afterwards, we need to check the water temperature with a thermometer. So we have our thermometer here, and then check the temperature. So the acceptable temperature range for warm water bath is 94 to 98 degree Fahrenheit, or also known as 34 to 37 degrees Celsius for wound cleaning and healing or relaxation, and also 110 to 115 degree Fahrenheit or 43 to 46 degrees Celsius to apply heat. And then we need to also take note that Sitz bath can also be provided with cool or chilled water. And then also pediatric or older adult patients and others with fragile skin should be treated with more moderate warm or cool temperatures compared to a normal person. So if we're using a Sitz bath kit, we need to clamp the tubing and fill the bag with water of the same temperature, and then hang the bag on a hook. Example is an IV pole, which is above the patient's head. So in this demonstration, I also have my bag here, which we can also attach to a place that is higher than the patient's head. So let's say we're going to hook it right here. And of course, just like what I've said, we need to fill it with the water with the same temperature. So let's say that we have filled it up, and then apply it or put it in the Sitz tub. So this one is just another method for the Sitz bath, but in this case we will be using a portable Sitz tub. And then afterwards, we need to assist the patient into a comfortable position, or we need to cover the patient with a towel in the tub that is on the portable tub, and then we need to cover the patient with a towel or a blanket. So we need to assist the patient. So the first thing that we need to do is to adjust the bed linen. And then afterwards, we assist the patient to the high Fowler's position. Ma'am, I will be moving you po. And then afterwards, if the patient can stand on her own or walk, we will let her do it. And then we also need to undress the patient so that she can proceed with the Sitz bath. So ma'am, I will be undressing you first before we proceed to our Sitz bath, so that your dress or gown won't become soiled. So now that our patient is now fully undressed, we're going to encourage the patient to sit in the Sitz bath for the prescribed period of time according to the doctor's order. And we need to keep in mind that warm Sitz bath are usually longer than cold or cool Sitz bath. So we're now going to let our patient sit for the Sitz bath. So ma'am, you will be sitting in our Sitz bath. And then after the patient is now sitting on the Sitz bath, we're going to provide a towel or a cover to provide privacy for our patient. And then throughout the procedure, we need to check with our patient after 5 to 10 minutes in order to confirm the following. So we need to confirm that the patient is comfortable and assess her heart rate, and for lightheadedness. So we're going to ask our patient, so ma'am, are you comfortable with your current position? If yes, we will going to proceed to the next assessment, which is the heart rate of our patient. So ma'am, I'm going to check for your heart rate. So in checking the heart rate, we need to cover a full minute. So there are different sites that we can use, but the most typical site is the radial pulse. So we're going to check the patient's radial pulse. So assumingly that we have checked it for 1 full minute and the patient's heart rate is just normal, we also need to ask the patient if she feels lightheadedness, which is a subjective cue. So we're going to ask it to her, and she needs to verbalize it. So ma'am, do you feel any kind of lightheadedness? And then if there's none, we're going now to proceed to our procedure. And then we also need to check that the water has remained with the correct temperature range. So again, we can use our temperature, our thermometer here to check the temperature. And if the temperature is okay, we need to also check that the patient is, if we're using a Sitz bath kit, we need to unclamp the tubing and allow the water to be refilled again. So this is our bag. So if we are primarily using this one, we need to unclamp it and refill the water inside it. And then in cases that if we are using a bathtub, we need to check the water temperature and refill the tub as needed. And then afterwards, after the prescribed length of time, we need to assist the patient in getting out of the bathtub or the Sitz tub, or to a standing position from being seated on the portable Sitz bath. So we're now going to assist our patient in her standing position. So we need to make sure that the patient has rise slowly, and after that, now that the patient has rise slowly, we need to assess for dizziness and poor balance. In this case, our patient is kind of dizzy and out of her balance. And then afterwards, we need to put on the patient back in her comfortable position. And then, after doing so, we need to set this aside. And then, using a towel, we need to dry the patient. So, we need to dry our patient. And then after that, we need to assess the patient's skin integrity and the condition of the treated area to evaluate whether the Sitz bath had the desired therapeutic effect. So we're going to assess the area. And then afterwards, we need to assist the patient in getting dressed into a comfortable position in a bed or the chair. So again, we're going to dress the patient. So ma'am, I will be dressing you again po since our Sitz bath is already complete. Now that our patient is now dressed, we need to clean or disinfect or store or dispose any used materials according to the facility protocol, noting that some of the materials like the portable Sitz bath might be considered as a reusable material. And then after that, we need to assess the patient's tolerance of the procedure and for any unexpected outcomes, including the signs of thermal injury. But upon assessment, our patient is just okay. And then afterwards, we need to assist our patient in the application of any prescribed topical ointments to the affected area. So if certain cases that our patient has become affected by the warmth of the Sitz bath, we're going to apply a topical ointment. So assumingly that our patient has experienced some burns, we're going to assist her in putting up some ointments. So ma'am, this ointment is for your burns. So I'm going to assist you. So and then apply the ointment into the burnt or affected area. And then afterward, we need to educate the patient, including her family, if appropriate about number one, how to perform the procedure so that they can implement it in a home setting when the patient return to her home. And then also how to connect the healthcare provider if or also how to contact or connect with the healthcare provider if questions or problems arise. And then also we need to teach them about the clinical signs and symptoms that can indicate medical problems during or after the procedure, and that should be reported immediately to the treating clinician. Let's say for example, there are presence of blistering, blanching, redness, and swelling on the submerged skin that persists after the area has warmed or cooled to the room temperature. And then also, we need to update the patient's plan of care if appropriate and document providing the Sitz bath in the patient's medical record, including the following information. So we need to document the date and time of the Sitz bath. We also need to document the temperature of the Sitz bath provided and any medication that has been used. We also need to document the patient assessment information that includes the skin assessment findings before and after the Sitz bath, the patient's level of pain before and following the performing the Sitz bath, and the patient's response to the Sitz bath, and the patient's tolerance to the procedure. And then any unexpected patient events or outcomes, interventions should be immediately performed, and whether or not treating clinician should be notified. So the patient and the family education, including the topics presented, a response to the education provided or discussed, plan for follow-up education, and details regarding any barriers to communication and or techniques that promoted successful communication provided. And then afterwards, we need to provide aftercare to our patient. And then we also need to remove our PPEs. And dispose the materials that have been used into our trash bin. And just like what I have said, we need to document every findings or data that has been gathered, and also the procedure itself. And then right after that, we need to again provide privacy, and then we need to perform hand hygiene. And then afterwards, we need to leave the patient so that she will have her rest. And then again, this is Marius Miguel C. Vismonte, your student nurse. Thank you for watching, and God bless.